on SiriusXM 81, Dr. Radio. Dr. Radio is a collaboration between the NYU Langone Medical Center in New York City and SiriusXM. The idea is to get you healthier. In this segment, we're going to talk about acid reflux and a wonderful new book. And you're wondering, why are we playing Roberta Flack? Well, the name of the book, the title of the book, is Killing Me Softly from Inside by Dr. Jonathan Aviv. It's the mysteries and dangers of acid reflux, its connection to America's fastest-growing cancer, which is esophageal cancer. And it also includes a diet that may save your life. So let me say good morning to Dr. Aviv. Jonathan, thanks so much for being with us.
Frank, thank you so much for having me this morning.
Aviv is a clinical professor of otolaryngology at the Icahn School of Medicine at Mount Sinai. He's an attending physician at the Mount Sinai Hospital. He's also the clinical director and founder of the Voice and Swallowing Center at ENT and Allergy Associates, LLP, in New York City. Again, the author of this new book. And I guess as every physician, I think, is quite aware, acid reflux has reached epidemic proportions, and we're seeing such a marked increase in esophageal cancer. And this is where Dr. Aviv's book focuses. And patients come in quite often. I'm a lung specialist, so I talk to patients a lot about their cough and their symptoms, and I'll often start to inquire about reflux or heartburn, and quite often I get the response, I don't have it, I don't have any heartburn. But Jonathan,
right.
One of the points you make is that, and maybe it's good if you can distinguish, what is heartburn and what is, as you point out in the book, might be better titled throat burn.
You bring up some great points, and the fact that you're seeing patients and that I'm seeing patients, and I look at it as we're in the clinical trenches, if you will. We see and hear the patient complaints off the street. We get a feel, a pulse of what's going on in our society from our patient encounters, and what we often encounter, and my biggest source of referrals really is the pulmonary community, because you're seeing patients who come in with cough, and you do a very thorough investigation of the source of their cough. In addition to a thorough physical exam, you're listening to their chest, perhaps imaging their chest. You may even decide to do an allergy workup, and it comes back negative. Astutely, you ask about diet. A lot of our patients never have heartburn. Heartburn is that feeling of a burning right around the bottom part of the rib cage that can sometimes climb up into the top of your chest all the way up to your collarbone. Almost none of my patients have that complaint. What they do complain of is chronic cough, hoarseness, frequent throat clearing. They're coming in going, and in addition, often a lump-like sensation in the throat. And I collectively call these symptoms throat burn reflux to distinguish it from the traditional heartburn reflux.
And you, in fact, as you describe in the book, and actually I must say I've had a similar problem, you've experienced I'll let you tell it what happened to you yourself. Actually,
yes, I mean, I start killing me softly from inside with my own personal experience, which was essentially jumping up in the middle of the night in the 1990s with a feeling of something choking me. I couldn't move air, and I realized that my vocal cords had closed, and it's a very frightening experience. And this experience, in fact, one of my patients called this a jump up, because he's jumping up in the middle of the night because the airway suddenly closes. And what's happening is, without heartburn, acid can silently climb up and actually hit the airway. And acid hitting the airway causes the airway to shut quickly. And that's the beginning experience of both my personal and professional journey to find out more about acid reflux and to prevent it as well as to treat it.
We tell listeners we're very fortunate to have Jonathan Aviv with us. Dr. Aviv, again, the author of Killing Me Softly from Inside. Take advantage of our having him with us by calling 1-877-NYU-DOCS. Maybe you've had similar symptoms. Maybe you're wondering, do you have acid reflux? How should it be treated? What's happened? Call us at 1-877-698-3627. If you prefer email, that's fine. We love email. docs@SiriusXM.com. We'll get your email on the air. Wonderful point you make in the book, Jonathan, about maybe explaining why there's such an epidemic. And sometimes I think everybody has acid reflux. And about the change in the American diet.
Yes, this is something that, as clinicians, we see these problems, and they're growing in frequency and incidence. You can appreciate this, and perhaps our listeners can appreciate this. 6 weeks ago, I had a young gentleman come into my office, 25 years old, complaining just of hoarseness. He didn't even have cough. He's hoarse. And I ask about his medical history and his diet history, and he tells me from age 15 he's been drinking 4 to 5 cups of coffee a day. Now, that's quite a bit, but okay, we'll go with it, right? So I examine his larynx, and it's extremely swollen. And I said, listen, we got to take a look. And we'll talk about this in a moment. So I do an awake exam of his esophagus. It's a spaghetti-like instrument with a little camera embedded at the tip, and it slides through the nose so you avoid the gag reflex, which sits in the mouth. And I saw Barrett esophagus. Barrett is a potentially precancerous condition where stomach lining, which looks like locks or salmon, creeps up into the esophagus. Now, you know this too. 10 years ago, if I were to say to someone, I diagnosed Barrett in a 25-year-old, they would put me away. Now we see it with regularity. So to your question, what happened? How did we get to this point? Well, let's turn the clock back. Not too far. We're not going to go back to the 1800s. We'll just go back to the mid-1970s. Two things happened. One, in the mid-70s, the FDA, the Food and Drug Administration, said that any food in a can or a bottle needs to be acidified to act as a preservative to prevent bacterial growth, to prevent botulism, which is a food poisoning which is devastating. So the impetus behind this change was a great one. Let's prevent food poisoning in our population. However, there was an unintended side effect, if you will. And the best example in one sentence is a banana. Think of a banana. That's a healthy, whole food. It is a near normal or neutral acid level. The pH, which is a measurement of relative acidity, is about 6. Baby banana food in a bottle has a pH of around 4, which is 100 times more acidic, and that starts in infancy. I mean, it's hard to get your mind around that. The other thing that happened is the food industry began to process foods in different ways. And again, I'll give one example that sort of crystallizes everything. Sugar. We talk about sugar. Dr. Lustig talks about sugar. What happened? What's the story with sugar? Well, in the late 70s, maybe around 1980, sugar went from the more expensive cane and beet sugar to the less expensive corn-based sugar, something we've all heard of, high fructose corn syrup. Now, so what's the big deal about high fructose corn syrup? Some people say sugar is sugar. Well, not so. High fructose corn syrup contains sulfuric acid, which is extremely acidic, and the chemicals used in the food processing have been shown to loosen the muscle that separates the stomach from the esophagus. So not only is acid coming down, you're physiologically altering and effectively temporarily paralyzing the muscle that separates the acid area, which is the stomach, from the esophageal area, which shouldn't have too much acid exposure.
This is Dr. Frank Adams on SiriusXM 81. We're very fortunate to have Dr. Jonathan Aviv with us, expert otolaryngologist, author of a wonderful new book, and it's chock full of information. It's outlined so beautifully, and it also includes a diet that actually may save your life. It's called Killing Me Softly from Inside, the Mysteries and Dangers of Acid Reflux. We have a caller on the line. We have Brittany from Massachusetts. I think it's a great question. Good morning, Brittany.
Hi, good morning, doctors.
Good morning, Brittany.
Hi, and I might just lose you because I'm about to go in a dead cell phone area. I've got a 25-year-old who, as a young kid, always had acid reflux. He went to, I think it was a gastroenterologist or something like that, and they diagnosed it as acid reflux. And recently, when I was with my husband at a urologist said that my young son needed to have the type of testing you're talking about because he had a chance of exactly what you're talking about. My concern is that until I heard...
Okay, so we lost Brittany, but I think she was trying to say that here's her young son, probably teenager, I'm guessing, a lot of acid reflux. She's worried about what Dr. Aviv has been talking about, Barrett's esophagus, the rise in esophageal cancer. She's wondering, does her son have a lifetime risk of cancer, and should he be scoped periodically, and is this alive?
Well, let's go with that. First thing, I just wanted to make this clear. Very, very young children, infants, toddlers, they don't have muscular development of these sphincters between the stomach and the esophagus and between the throat and the esophagus. So reflux is typical in very, very young people. In the situation of the teenager, it's a little different. And the question of should they be examined, how frequently should they be examined, what should they do, the first thing I would do, and it's akin to how the lung doctors have taught us to approach patients, is we listen, we look. So we look at the vocal cord area first. Indeed, if there is swelling in that area, the first thing I would do is ask about diet. What are they eating? Are there a lot of soft drinks? Is there a lot of carbonation in the diet? People say, okay, they get the idea of soda, which incidentally, again, going back to the mid-'70s, soda overtook caffeine or coffee as the most commonly consumed beverage, and sodas are the most acidic substances we consume on a daily basis. So, the diet history is so critical. We're taught that in medical school, but as we go on, sometimes that very, very basic fact about what is someone putting in their body on a daily basis, how is that affecting their symptoms, sometimes that goes by the wayside. So constant emphasis on diet. What is this person eating? So step one, history, right? What are they eating? What are they putting in their body that's making them feel this way? And then taking a look, and depending on what that information shows, they may or may not need a look at their esophagus. But once the esophagus is looked at, even if there's a little inflammation or everything's okay, I would approach this first with diet. Let food be medicine. Food as medicine can be a very, very useful mantra as a place to start.
Okay. Brittany, we're sorry we lost contact with you, but it's a great question. And we're talking with Dr. Jonathan Aviv, our expert otolaryngologist, author of Killing Me Softly from Inside, The Mysteries and Dangers of Acid Reflux. And I want to again point out that it includes a diet that Dr. Aviv has put together with recipes and all the wonderful things you need, even what you have to buy. And he's made it easy for people who, like myself, who aren't really familiar with the kitchen and cooking and putting things together. So it's a wonderful resource for everyone out there. Here are our toll-free numbers to reach him: 1-877-NYU-DOCS, 1-877-698-3627. Email us, docs@SiriusXM.com. Jonathan, again, so no question in your mind the link between esophageal reflux and reflux and esophageal cancer.
Well, the data goes back many years, showing the connection first between acid reflux and inflammation in the esophagus, and then there's a stepwise transformation of tissue from normal appearing to slightly inflamed to very inflamed to then a different type of tissue. So it was discovered that when stomach lining creeps up into the esophagus because of acid injury, the esophageal lining tissue starts to change. Think of towel snapping some skin. You keep towel snapping, eventually that skin's going to break down. And if you keep damaging it, you're going to have more than just a little skin breakdown. And that's what was shown, this transformation of normal, healthy-appearing tissue into progressively more and more inflamed, damaged tissue to the point of transforming into a precancerous state was established a long time ago. People quibble with this. However, we've seen this progression not only in the esophagus, we've seen it in the lung, we see it in the larynx, and the entire concept of inflammation and reducing inflammation as a source of cancer everywhere is very well established. The whole concept of antioxidants, oxidation is part of the inflammatory process. And you mentioned something very important about being facile or comfortable in the kitchen. I think that having a diet that's very complicated or that takes a long time to make the foods, especially for a refluxer, is the last thing we want. Frank, do we want a refluxer to be marinating in the kitchen for hours on end? That's like the fox guarding the hen house. We don't want that. So the diet I developed, which is called the Acid Watcher diet, is a low-acid, high-fiber diet that has a balanced amount of the three macronutrients, that being proteins, fats, and carbs, and it's designed to heal the body from years of acid damage. And to your point, the recipes were specifically created to take 5 to 10 minutes to make. So it's quick, it's very tasty, and it's not a deprivation diet. I think one of the problems with a diet that says you can't eat fats, you can't eat carbs, it's very difficult to sustain that type of diet. However, when you're balancing everything, it's very easy to follow.
Unfortunately, our time is running so quickly. We're under 5 minutes with Dr. Jonathan Aviv, and I know there's a call, there's an email, but quickly, I'm one of those crazy people. I like to go into pharmacies and look and see what's on shelves, and if you go anywhere near the GI section, we have a ton of anti-acid type medications, from the traditional old antacids to the proton pump inhibitors like omeprazole, and I know there are people out there thinking, well, I don't need the diet. Dr. Aviv, he's got a great diet. All I got to do is to take medication. Is medication that suppresses acid, is that enough?
The issues with medication are twofold. One, I believe, and again, it's the pulse of what we hear from our patients. Most patients prefer not to take medicines. But let's say they say, listen, I don't have time for this nonsense. I'm going to eat what I want to eat. Everyone leave me alone. I'm going to take the medicine. Well, the medicine is extremely effective. However, as one can imagine, over time, it has been shown in numerous studies that there's some issues with some of these medicines. Some of these medicines may impair calcium absorption over time, and that can result in weakening of your bones and can result in an increased incidence of fracture. In your own practice, they talk about long-term prescription use or even non-prescription use of anti-acid medications that can increase the chance of pneumonia. So there are well-established long-term consequences of these types of medications. And if you could, again, use food as medicine, for example, as I describe in the Acid Watcher diet, you're giving yourself many greater options and many greater healthy options to achieve the same point.
Okay, only down to 2 minutes. So I got a quick question from Lynn in Arizona. Lynn, good morning.
Yes, hi, thank you very much.
Good morning, Lynn. You're up early.
Yes, I do get up early. I carbonate plain water. I don't flavor it or anything, just plain distilled water in the evening for dinner.
Uh-huh.
Is that acidic?
Well, this is what carbonation does, and you ask a fantastic question, because there are carbonation stations everywhere and companies that are make your own carbonated stuff at home. Well, what's the issue? Carbonation are gas bubbles, right? Gas bubbles in the stomach cause the stomach to distend or bloat. You may not feel it, but it's happening. The equivalent of a quarter liter of water becomes a half a liter, right, twice as much when it's carbonated. And what carbonation does is basically blow up the stomach, so things in the stomach will reflux up the wrong way. So I'm not a fan of carbonation. And if you want to take it even further, if you're a history buff, think of acid ions latching onto these little air bubbles, climbing up and exploding over your larynx or throat or voice box like the Hindenburg, right? So distension, irritation way up high in the esophagus and vocal cord area, not a good idea.
Lynn, it's a great question. So many people out there are doing this. I'm glad you called and asked it. And we're under a minute, so all I can say is, number one, first, everyone out there, this is such a helpful book, Killing Me Softly from Inside, The Mysteries and Dangers of Acid Reflux. It includes the Acid Watcher's Diet by Dr. Jonathan Aviv. Jonathan, we ran out of time so quickly. I know we're going to ask you back. Good luck with the book. It's wonderful. We appreciate you being here on that.
Frank, thank you so much. Have a great day.
Sure.